Is every difficult experience a trauma? In counseling, this is one of the most important and most misunderstood questions. While all trauma involves adversity, not all adversity becomes trauma. As clinicians, how do we actually distinguish the two in clinical setting? Let's break it down now. Hi everyone, welcome back. Whether you are a counseling student, a practicing therapist, or someone who's trying to better understand your own experience, today we are clarifying a fundamental concept: the differences between trauma and adversity, and why it matters. Clinically, the definition of trauma are often informed by DSM-5. In that framework, trauma involves exposure to actual or threatened death, serious injury, or sexual violence. However, counseling practice extends beyond diagnostic criteria. Many trauma-informed models emphasize that trauma is not defined only by the event itself. Instead, trauma is understood as an experience that overwhelms a person's capacity to cope and leave a long-lasting dysregulation in their nervous system. In other words, trauma is not just what happened. It is how your system have to do to survive it. When trauma is present, we often see symptoms such as prolonged anxiety, emotional numbing, intrusive memories and flashbacks, or persistent relational difficulties. The nervous system remains stuck in a survival mode. So how do we define adversity? Adversity is a broader and more neutral term. It refers to difficult life circumstances or stressors, such as poverty, discrimination, immigrational stress, or chronic illness. While adversity may increase long-term health risk, it does not necessarily automatically result in trauma. Many individuals endure significant hardship in their life, yet still maintain regulation, attachment security, and cognitive flexibility. Adversity only becomes trauma when it overwhelms one's coping capacity and disrupts regulation in a long-lasting way. In counseling, we distinguish trauma and adversity by asking ourselves, was the person overwhelmed beyond their capacity to cope? Were they able to process and integrate the experience, or did it remain unprocessed or dysregulated? Adversity can be painful, stressful, even life-changing. But if an individual has adequate support, safety, and resources, the experience may be integrated without long-term traumatic symptoms. Trauma, on the other hand, is marked by fragmentation. The experience remains emotionally and physically unfinished. So, an exact same event can be traumatic for person A and not for person B. Why is this the case? That's because trauma is mediated by various factors, such as developmental stage, cultural background, social support, nervous system sensitivities, and so much more. In counseling, we try to avoid ranking suffering. Instead, we evaluate the impact on the client. The shift from asking, how bad was the event itself, to asking, what was the impact on this client's system? The distinction affects assessment and treatment planning on our side. If we mislabel adversity as trauma, we may overanalyze normal stress responses. But on the other hand, if we mislabel major trauma as merely stress, we may push cognitive strategies and make assumptions too quickly without first establishing safety and regulation. So here's our key takeaway. Adversity refers to hardship. Trauma refers to overwhelmness that exceeds coping capacity and leaves long-lasting dysregulation. All trauma involves some level of adversity, but not all adversity necessarily becomes trauma. Understanding this distinction allows us to maintain clinically process while honoring the client's lived experience. If you find this short video to be helpful, consider subscribing for more counseling education content. And I'll see you in the next video.